Hello everyone. Thank you for watching my PowerPoint presentation about evidence-based nursing practice, the benefits of using it in the nursing workplace. The influence of evidence-based practice is becoming the accepted way to provide care within nursing practices, teaching, and health sciences. The need for evidence-based care is uprising due to quality review guidelines and Medicaid reimbursement. Healthcare transformation emphasizes prerequisites for redesigning medical services that use best practices along with safe and efficient care. In 2015, Weyer, Umscheid, Wright, Silva, and Lang discovered that simple medical strategies remain ignored and decision support tools are inconsistently employed. Copious amount of literature proves that there is a disappointing number of current practitioner-based enlightening efforts to change their behavior. Also, a breakthrough study disclosed that regardless of the lushness of technology and resources within the United States healthcare structure, only half of Americans receive evidence-based interventions. In 2009, Melick, Feinout Overholt, Stilwell, and Williamson found that the Institute of Medicine has set a goal that by 2020, 90% of all healthcare decisions in the United States will be evidence-based. Evidence-based nursing is very intriguing to me. I find it vital to use whenever you are implementing nursing skills, techniques, and care management to your patients and members. When you are performing this task, you are providing the best clinical expertise that is available for the consumer. There will be a reduction in hospital days, and individualized care is given from the time of arrival to the time of discharge. Your patients and consumers of health will now see the effects of high value in their healthcare experience. Now let's talk about what is evidence-based nursing. According to the Institute of Medicine, evidence-based practice is the incorporation of a brilliant study, scientific know-how, and high consumer standards in creating choices about the care of the patients. The research discoveries are an assemblage of truths. It develops into evidence when the conclusions are pertinent and beneficial in a specific clinical circumstance. EBP considers inner core and outward impacts on practice and inspires critical thinking of such evidence to the care of an individual patient, a patient population, or a system. Evidence-based practice, a crucial competency for healthcare providers and a fundamental force in magnet hospitals, results in better patient outcomes. When should evidence-based nursing be used? Our nurse practice setting has a rich history of using research that was pioneered by Florence Nightingale. And even though during the mid-1900s, only a select choice of nurses promoted this underpinning that was initiated by her. Evidence-based healthcare practices should be carried out when caring for consumers that creates the necessity for clinically essential data about diagnosis, predictions, treatment, and other healthcare issues. Some chronic health conditions such as COPD, congestive heart failure, diabetes, and asthma can benefit from evidence-based nursing interventions from research studies such as a cohort, double-blind, controlled trial, or a randomized controlled trial. Each type of study is based on the kind of questions and answers that is needed to help with that evidence. You should use systematic reviews also if any other information is needed for evidence-based practice. There are 5 steps to using evidence-based nursing at your workplace. The first step in evidence-based nursing is to ask a question that arises with the patient. Some examples would be how to verify proper placement of a gastric tube, or does progressive mobility really combat deep conditioning? Step 2 is to search for the best evidence. You can choose the info from a database or resources most likely to reply back to the type of question being inquired. Utilizing keywords and notions with a combination of multiple search terms are ideal. For example, nurses use a variety of techniques to distinguish when a nasogastric tube has been placed correctly. The most common ones are auscultating lung sounds during air insufflation through the tube, testing the pH of the aspirated fluid, visualization of aspirated liquid, carbon dioxide detection in the tube, and radiographic tube conformation. Now that we know these theories, we must apply our best evidence and knowledge to provide safe and competent nursing care to our members and clients. The third step is to evaluate your evidence and appraise this evidence for validity and clinical usefulness. As stated before, we are aware of the techniques that are in place, but we must know the best practices to use that is based on research criteria from sources like the National Institute of Health, U.S. Surgeon General Office, and the National Institute of Nursing Research. We always knew that immobility could lead to decreased lung expansion, which can lead to pneumonia in a hospitalized patient. Turning every 2 hours is not sufficient enough. Once stable, we should attempt to raise the head of the bed 30 degrees and then try to allow the patient to dangle their legs with light bearing if tolerable. Research has shown that this technique has reduced hospital time and better oxygenation due to more significant lung expansion. Step 4 is simple. Apply the evidence. Your verdict is then implemented in your area of practice, which is defensible by the evidence you have obtained to promote quality and competent nursing care. And the final step is to assess your performance. Asking questions like, was the application of the new intervention practical and relevant to the client? Did it produce a positive result that was based on scientific evidence? Was there any harm to the client? Would you use this in your nursing practice again? In conclusion, our nursing practice today will continue to evolve around specialized care and modern treatments to promote wellness and healing. Nurses are at the forefront of medical decision-making and political involvement around the nation. Advanced degrees and certifications are beneficial to the clients that we serve based on the gainful research practices that can be applied to them. I hope that you will continue to use evidence-based nursing in any decision that you make for your clients. Not only will they be safe, but they will remain up to date with the right care and treatment. I thank you all for listening to my PowerPoint presentation.